Hi, I am Geraldine, a student nurse. I met you sometime in the OR. My objective data insinuates that you need some mental help, so I want to collect some subjective data before arranging for psychiatrist help. Okay? Thanks.
Wrong. 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 Do not do that. Why? 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 Why me? Cancer.
What do you mean by that?
I was just informed that I have a prostate cancer and I would be undergoing a radical prostatectomy for its treatment.
Oh. That's too much medical terminologies. Please, a little clarification will help my knowledge and the accuracy of my assessment.
Radical prostatectomy is a surgical therapy for prostate cancer.
What is a prostate cancer?
Prostate cancer is a malignant tumor of the prostate gland.
What is a prostate gland? What are the functions of a prostate gland?
I thought you were supposed to be a nurse. You should know the answers to that question.
Well, these questions constitute for the accuracy of my assessment, yes, so go on and answer the questions.
Okay, well, the seminal vesicles, the prostate gland, and the Cowper's bulbourethral glands are the accessory glands of the male reproductive system. These glands produce and secrete seminal fluid, semen, which surrounds the sperm and forms the ejaculate.
Okay, I see. So what's the prevalence of prostate gland cancer?
Prostate cancer is the most common cancer among men, excluding skin cancer. 1 of every 7 men will develop prostate cancer at some points during their lives. The majority, about 75, of cases occur in men over age 65, but can occur in young men who have a more aggressive type of cancer.
Do you have an idea on the pathology and etiology of prostate cancer?
Well, prostate cancer is an androgen-dependent adenocarcinoma. It is slow-growing and can spread by 1. Direct extension, involves spread to seminal vesicles, the urethral mucosa, the bladder wall and the external sphincter. 2. Through the lymph system, spreads through the lymphatic system to the regional lymph nodes. 3. Through the bloodstream, the veins from the prostate gland facilitate the spread of the cancer to the pelvic bones, the head of the femur, the lower lumbar spine, the liver and the lungs.
So what are the risk factors associated with prostate cancer?
Risk factors include age, ethnicity, family history, long-term exposure to testosterone, diet high in fats and low in vegetables and fruits. New research also states that there is a possibility that men taking high levels of multivitamins along with other supplements have increased risk of advanced and fatal prostate cancers.
So do you speak or understand French?
NN1. And what has that got to do with my diagnoses? Oh, my pain. Oh, my life. So gone. No one care. Not a single human species.
No, I really care about your well-being. Your story is interessant. I just wanted to be sure I was pronouncing the right French word. Sorry for the interruption.
Can you be serious and continue with your documentation or rather your assessment? I like to educate empty barrels.
Oh. Great. More interruptions will earn greater accuracy. So with an exception from the instinct, call your helper an empty barrel, what are other clinical manifestation and complications of prostate cancer?
Symptoms of prostate cancer includes dysuria, hesitancy, decrease in the caliber and force of the urinary stream, dribbling at the end of urination, urinary frequency and urgency, hematuria, nocturia, retention, interruption of urinary stream, stopping and starting stream several times while voiding, and inability to urinate. He would also experience pain in the lumbosacral area that radiates down to the hips or the legs. If the pain is coupled with the urinary symptoms, it may be an indication of metastasis. Metastasis is the spread of cancer from the primary or initial site to a distant site. Prostate cancer is usually asymptomatic in the early stages.
So which of these symptoms did you experience?
All. Oh my! How could I have missed that? Hey, tell me how. And you know what?
What?
I wish I went for a test earlier. The metastasis could have been prevented. I just realized that early recognition and treatment controls the growth and prevent metastasis. Oh, my life. My life. My life. My life. I thought. I just knew I had it, but I guess I was in denial for a while.
So how did you validate your thought?
I went for a diagnostic test. There are 2 primary screening tools used to determine the presence of prostate cancer.
Are you sleeping on me? Am I so boring? Well, we are not done with the assessment. So what are the primary screening tools that are used to determine a prostate cancer?
No, just some thought running in my head. Well, they are digital rectal examination, DRA. An abnormal prostate may feel hard, nodular, an asymmetrical blood test for prostate-specific antigen, SA is a glycoprotein produced by the prostate. Serum SA levels are a useful marker of tumor volume. The higher the SA level, the greater the tumor mass. Prostatic acid phosphatase, PAP, and elevated level of prostatic isoenzyme of serum acid phosphate may indicate the presence of a prostate cancer. The ultimate indicator is a biopsy with a transrectal ultrasound, TRUS.
I think that should be okay for now. I will inform if I have more questions for you. Thanks for your time.